This is the part 2 of the head to toe health assessment, and we're going to start with the cardiovascular, or no, we're going to start with respiratory and then move on to cardiovascular. Okay, so after I've done all the rest of the assessment in the first video, I'm going to move on to doing respiratory. And you would instruct your patient that you are going to, every time I move this, I'm going to place this on your chest, and then every time I move it, I would like you to deep breath in and deep breath out, okay? Inhale and exhale, and every single time I move it, because I'm going to be checking your respiratory sounds. And I'd also mention, I did mention it before in the first video when I was doing a just overlook of her, my initial assessment, looking at her, that she was not using any accessory muscles because she didn't look like she was in any respiratory distress. So I also note that here, that she's not using any accessory muscles to breathe. Okay, so we're going to do both your anterior and posterior, your front and your back. Okay, so we're going to go ahead. Okay, this is her right upper lung. This is her left upper lobe. This is right middle lobe. Left lower lobe. Right lower lobe. Left lower lobe. Okay, if you can turn that way. Okay, start with your left upper lobe. Your right upper lobe. Left lower lobe. Right lower lobe. Left lower lobe again. And right lower lobe again. Okay, all sounds good. I don't hear any adventitious lung sounds, like wheezes, crackles, any of the above. It all sounds normal, so you would note that. Okay, so next we're going to move on to your carotid, or your cardio, and we're going to start with your carotid. And you want to do these one at a time. That's good. Then next I would check for jugular vein distension. I don't see any. If I did, she would be laid back at 45-degree angle on the bed, and then you would do measurement of it and get the tools out necessary for that. But I don't see any present, so we won't have to do that. Okay, so next I'm going to palpate your pedal pulses. So that's going to be your dorsal medialis and your posterior tibialis, and we're also going to then palpate your radial pulses in your arm, your wrist. Okay, that one is good. Also good. It's good. Good. I would say that her pulses are 2+. They are normal for rate, rhythm, and amplitude and strength. We're going to move on to checking her radial pulses. I would say those are also 2+, normal for rate, rhythm, and strength. If we were doing vital signs, you would continue to, you hold that for 30 seconds for normal vital signs to check pulse, and then you would hold them for another 30 seconds to pretend like you were doing that to check her respiratory rate. Okay, so now we're going to listen to your heart sounds. But before actually I get there, I'm going to, while I was doing all these things, I was also checking for any edema. That would be signs of heart failure, and I did not see any present. So now we're going to move on to listening to your heart sounds. And I'm going to use both my bell and diaphragm. So I will do all 5 spots with one side of my stethoscope, and then I will do all 5 spots again with the other side of my stethoscope. Okay. So first we have your atrial. then pulmonic, Erb's point, tricuspid, and mitral. Okay, now we're gonna flip it over, do it again. We have atrial, pulmonic, Erb's point, tricuspid,
Usually we do these when he takes a nap.
yeah,
What do you need, sweetie?
Sorry.
Here, you want to sit with me? Want to sit with me? Say, Mom, let's work again.
and mitral. Ignore the little toddler in the video. Hi, baby.
Oh my gosh.
Okay, so I did not hear any bruise, any whooshing sounds, or anything of the sort while we were doing her cardio assessment. Obviously, my son does not like the stethoscope very, very much. Doesn't like mommy having to have that on her ear. Okay, so excuse us a moment while we distract him. You say hi. You say hi. Okay. Next, we're gonna do GI. So we're gonna do, if you can stand up, please. We don't have a bed for her to be laying down in. We're gonna move the camera to, so we're going to do it with her just standing up. Okay, so what I'm gonna do is, first I'm gonna inspect, and her abdomen is a flat contour. If she would be laying down, it would be flat. It is symmetrical. I don't see any abnormal bruising or discolorations. I don't see any hernias around her umbilicus. The color is appropriate for her skin tone, for her ethnicity. And it would be, it's like I said, it's symmetrical, so it all looks good there. You always want to inspect first, and then we're going to auscultate, because if we were to go directly into palpation, that would create it could create hyperactive bowel sounds, and we want to see what people's normal bowel sounds are. So if you're pushing around, that could create some more. So we're going to auscultate first. So first we're going to start in the right lower quadrant here, and then we're going to work our way around clockwise. And that was the right upper quadrant here. We're going to the left upper quadrant and left lower quadrant. Okay, now we're going to do some light palpitation. Take your fingertips, kind of move in a circular motion. You should not be able to, and that's the right lower quadrant, you should not be able really to feel anything, maybe a tad bit of the liver, but really, if they're normal, they should not be anything. That was the right upper quadrant, it's the left upper quadrant, and the left lower quadrant. Did you feel any pain when I was doing that? Okay. And her bowel sounds were normal active, meaning they're just normal sounds that should be present there. And that was normal as well. So, now we're going to move on to musculoskeletal. We're going to make sure she's got range of motion and strength. So you can stay sitting for it. We're going to do your upper extremities first. Okay, so first you want to make sure, you want to feel the joints and look at them and make sure that they are symmetrical bilaterally for contour and shape. And I would say that she is on both of those. We're going to check her wrist next. She is symmetrical for contour and shape on her wrist as well, because those are the other joints we're going to check. So now we're going to do range of motion. So can you abduct away? Can you adduct back? Can you raise your arms up? Can you put them backwards a little bit? Okay, and then can you do circle? Okay, this is a ball joint, so she should be able to circle her arm around. Okay, so you full range of motion, equal bilaterally in both your right and left. Now we're going to do strength. So I'm gonna push against you, and I want you to lift your arm up. Okay, and now we're gonna have your arm up, and now push down. Okay, I'm gonna push against you, push down. Okay, good. I would say that she's got 5, which is full strength with resistance, with her strength on both sides of her muscles and those joints. Now we're gonna do your wrist range of motion. Can you put your wrist back? Can you jump forwards? Can you do a waving motion? Can you kind of rotate them around? Okay, she's got full range of motion in both her right and left as well. So now we're gonna do strength. You have your arm. Can you push down? Okay, leave them flat. Can you push up? Okay, so she's got full strength on both sides as well in her wrist, and that would also be a 5. Okay, now if you want to stand up to do your, we're gonna do our hips. Okay, so can you, first I would check for symmetrical, and the contour be the same. You probably have somebody more being in their underwear so you can see it better, but for this video we're just gonna say that we can see that, we can feel it, and it's all equal bilaterally for shape and contour and symmetry. Okay, so now can you abduct away, abduct back, okay, you're okay. Can you do internal rotation, external rotation, and then circumduct? Okay, can you do it on both sides? Do the other one. Can you do internal rotate, external rotate? Okay, she's got full range of motion in both of her right and left hips. And now we're in chest strength. You can sit back down for this one. Okay, I'm gonna push down against your thigh. No, you gotta push down. Oh yeah, no, you're right. Okay, I'm gonna push down and you lift up. Okay, do the other side. Okay, and now pull down. Okay, so she's got full strength with resistance on her hips as well, and that would be a 5. So now we're gonna do your ankle. Okay, can you dorsiflex back? Can you plantar flex forward? Can you inversion, eversion, and can you kind of rotate, roll it around? Okay, so her left has full range of motion. Now we're gonna check her right. Can you dorsiflex back? Can you plantar flex forward? Inversion, eversion, and kind of rotate all around. Okay, so she's got full bilateral range of motion for both her right and left ankles. Now we're gonna do strength. I'm gonna push against, okay, and you push up, good. I'm gonna push against, there you go, push up, there you go. So she's got full strength in her ankles as well, and that would also be a 5. Now we're going to do the soft and dull test. I'm going to take this little Q-tip that has a sharp plastic end, there's a puffy end, and soft side. She's gonna close her eyes. I'm gonna touch her from shoulders all the way under her feet, and she used to say soft if I touch her with the soft side, and dull if I touch her with the kind of sharper plastic side. Okay, you ready?
Soft. Soft. Dull. Dull. Soft. Soft. Dull. Soft. Dull. Dull. Soft. Soft. Dull. Dull. Soft. Dull. Soft. Dull.
Okay, so she's got full feeling, sensory feeling from her arms to down through her thighs, to her knees, calves, into her feet. So that's good. If she was starting to have some peripheral neuropathy, she'd probably not be able to feel the things in her foot. Okay. When she walked in originally in the first video, I noticed that she had normal gait. She was obviously able to stand up and do the range of motion things as well, having good balance, and she doesn't use any assistive devices, so her gait is normal for her. So then, when we were done with the assessment, I would thank my patient for being here and taking her time up for the day to be doing this. I would ask her if anything came up, and I would assess for her pain levels that she had. I asked her in the first video, make sure nothing came up when I was doing this, because I was poking around and making her move and stuff. If we were in a hospital, I would lower the bed, I would put the guardrails up, I would lock the wheels on the bed, I would put the call light in within reach. I'm going to thank my patient again for taking her time and being so cooperative. I would perform hand hygiene, and that would be the end of my physical assessment.